Hi again, Ryan Smith at Better Life Carolinas. Thought we would talk a bit about preventative screening. This is such a big focus of our practice, and when we are talking about longevity and age management, a big part of that, the biggest part of that, is avoiding chronic disease. And the big three chronic diseases that we focus on are atherosclerotic heart disease, neurodegenerative disease, and cancer. So I thought we might address each of those separately and kind of give you a quick rundown of our approach to how we try to reduce the likelihood that a patient may develop one of those. The first disease process that we'll talk about is atherosclerosis, and that is the process by which cholesterol enters the lining of blood vessels and becomes oxidized and inflamed and results in the formation of plaque. And this is a long-standing process. This starts decades before it becomes a problem. And unfortunately, it is the leading cause of death in our country and in all of Western society. It's almost ubiquitous, and because of that, we really focus heavily on prevention. Atherosclerosis is a disease of modifiable risk factors. And we know a lot of these. We know that smoking is a big risk factor. We know that diabetes is a risk factor, hypertension, high cholesterol. These are the modifiable ones, and so that's what we really focus on. And our approach is to look at each of those individually, but then to kind of put all the information together to paint a picture and determine whether more advanced testing or screening needs to be done. So when it comes to assessing diabetes or elevations in blood sugar, we start with our laboratory studies. And we look at a number of different things. We look at your fasting blood glucose, your fasting blood sugar. We look at your fasting insulin level. That's the main hormone that helps to regulate your blood glucose. Those are snapshots in time. They give us a sense of what's happening right at that moment. So it's not the most ideal way of gauging issues that a patient may be having over a longer period of time. To help address that, we look at hemoglobin A1C, which reflects blood sugar control over the past 3 months or so. That also helps. It's not a perfect test, but it gives us a sense of chronicity and timing. Beyond those, we also use a newer type of technology called continuous glucose monitoring. This is a device that comes in a kit. We can place this device subcutaneously, either behind your arm or above your waistline, and it uses a needle to place a small subcutaneous filament, plastic, but once that filament's in place, the needle's gone, and it's not uncomfortable. It's actually quite a painless process. This device will communicate with your phone via Bluetooth, and it provides continuous minute-by-minute glucose readings. And you can leave it on for about 10 days, and during the course of that time, you really can gain a lot of information that you otherwise would not get from standard lab work. It allows us to gauge your average blood glucose level, but it also really lets us see how high your blood sugar peaks after a meal. That's important. It gives us a sense of how variable your blood glucose is over the course of a day. And that variability is important as well. These are all pieces of information that give us an overall sense of your metabolic health. For cholesterol monitoring, we look at the standard cholesterol panels that you might get at a typical doctor's visit, but we also like to use more advanced metrics. For example, apolipoprotein B is a metric that is much more highly correlated with heart disease risk than the standard cholesterol panel. We can also perform analyses of cholesterol particle size that can impact your risk, and we can perform tests that look at relative overproduction versus overabsorption of cholesterol that help us to guide therapy more effectively. Once we've gathered all the information that we think paints an adequate picture of cardiac risk for a given patient, we have the option of pursuing more advanced testing. One type of testing that we routinely do is coronary CT angiography. This is a non-invasive test that uses contrast and allows us to visualize the coronary arteries, the arteries that go to your heart. And by doing this study, it allows us to visualize blockages that might exist because of plaque. Beyond just that test, though, we have the option of sending the results of the CT angiogram to a company called Clearly. Clearly uses an AI-enabled algorithm to provide more information about the nature of the plaques that might be present. It allows us to know the exact volume of plaque, the overall plaque burden, and most importantly, the composition of the plaques. That's important because not all plaques are created equal. Some plaques are hard and calcified. Those are the ones that tend to show up most clearly on CT angiograms. But those are actually the ones that are less concerning. The ones that are more concerning are those that are softer and less calcified. The reason those are more worrisome is that those types of softer plaques are more likely to rupture. And when plaque ruptures, it can cause a cascade of events that results in a rapid clot forming that can result in a heart attack. So the soft, less calcified plaque is actually more concerning because it's at greater risk for rupture. Having this Clearly analysis will give us a sense of the relative burden of soft plaque compared to hard calcified plaque. And this is something that we can track over time, and with therapy we expect to see that stabilize or even revert. By allowing us to distinguish between the different types of plaque, Clearly really allows us to get a better handle on the immediacy, the urgency of disease, and it really helps us to tailor our therapy appropriately.